We're live.
Okay, come in a little closer so you can hear this noise in the background. Dr. Moak here with Morgan, and she's graciously let us train people how to do a facial nerve block for Fraxel. And you're getting Fraxel for the acne scarring. Have you ever done Fraxel before?
No.
Well, it hurts. That's one of the things. You want to make it not hurt. Can you grab me the dental syringe and some lidocaine with epi? So we're going to do a facial nerve block using lidocaine with epinephrine. And it's a nerve block, so she should be pretty painless. It can be done for things like facial fillers or all therapy, which is very painful. So there's a few nerves we're going to treat. First is the supratrochlear nerve, the supraorbital nerve, and a little less important nerve called the lacrimal nerve. So I'm going to inject those. And I'm using lidocaine with epi and bicarb on a small 30-gauge needle. And a little poke here. The nerve block takes about 15 minutes to be effective and lasts for about 2 hours.
What is the depth?
And just subcutaneous,
Okay.
so just under the skin. And here's the thing about nerve blocks is that volume beats precision. So if I put enough in there, I don't have to be really super accurate, it'll work either way. The next nerve we're going to do is this zygomatical temporal and zygomatical facial nerve. So there's the intersection between the lateral orbit, a line drawn this way, and the zygomatic arch. And right here, there's just underneath the bone, there's basically a zygomatical nerve, and it innervates this portion of the face. So this here, what I've done already, will numb the entire forehead. And this, yeah, here I numb there. And this right here will numb up the mid-face.
Roughly how much per injection?
How many you, okay, so the lidocaine with epinephrine, the safe dose is 7 milligrams per kilogram. So if somebody weighs 100 pounds, they're kind of light, we divide that by 2.2, and then we times it by 7, and divide by 10, you get 32 cc's, okay? So I know everybody's safe with 32 cc's, so I brought 30 cc's in here, that way I don't have to do the math and figure out the proper dose. But I'm using about, up here I use 2 cc's, here I use 2 cc's.
Okay.
Now for the auricular nerves, there's a great auricular nerve and there is a auricular temporal nerve that runs here. Great auricular nerve comes from the cervical plexus and innervates this area. The auricular temporal nerve runs up this way. So I'm basically gonna, again, precision is overcome by volume. I'll put a little volume in here, right along your ear, and about 2 cc's.
Still just subcutaneous.
Just subcutaneous. Now I'm going to do a infraorbital nerve block from the inside of her mouth. This is a dental syringe. It's self-aspirating. It's nice and smooth. And I go between the third and fourth tooth, right towards the mid-pupillary line, just underneath the orbital rim. Put about a half cc here. Same thing on the other side. You don't have to use one of these dental syringes, but it feels way more comfortable doing it this way than with other syringes. These don't really hurt much.
What is this? The purpose of this facial block?
So that she can have a very aggressive Fraxel treatment done with basically painless. So she's going to put up with about 2 minutes of me giving her shots, so she can do a 30-minute procedure that she almost feels nothing. And you are going to grade it. This is the mentalis nerve between the fourth and fifth tooth, right under the mandible. Half cc there. So we've done the mid and upper face. It's normal to tear up a little bit when you shot it on your eyes. So we did her supratrochlear nerve, supraorbital nerve, lacrimal nerve, zygomatical temporal and frontal nerve, auricular nerve, both great and auricular temporal nerve, infraorbital nerve, mental nerve, and now we're going to do a cervical block. Now there's 2 types of cervical block historically been reported. One is called the intermediate block, where you take an ultrasound. You go to a point called Erb's point, right behind the sternocleidomastoid. It's at the junction between the lower 2/3 and the upper 1/3, so you put a shot right behind the muscle. Well, it's a relatively complex procedure for me to train people. There's some inherent risk of going too deep and getting into the breathing nerves. So they've done studies where we use blocks a lot, like doing carotid surgery and neck surgery, and they found that you can do this kind of shot, which is very technical and sophisticated. We actually put little boluses along the sternocleidomastoid muscle. They work exactly the same, but now we're in a totally safe zone. Okay, so this is a perfectly safe procedure. I don't need an ultrasound to worry about her breathing nerve or watching her airway. So I'm just going to feel her sternocleidomastoid, which is this muscle right here. It's real prominent. And I'm going to give her a shot. So the cervical plexus is right here underneath the muscle. But as it exits, the great auricular nerve exits here, The cervical nerve exits here, the clavicular nerve exits here. So when I put boluses along here, it's going to just by volume hit everything. Now in her case, we're not doing anything on her neck. I'm only trying to control the lower auricular nerves. So I'm going to stop here. If I was doing fracture of the neck as well, I'd go all the way down to here. But in this case, we did not need to do that. Okay, so that's going to block all this. I'm just going to use it for the rest of my You come around the other side, do the
Okay.
same thing.
So-
This block takes about 15 minutes to set in.
Okay. Taylor just had a nerve block for a Fraxel. Taylor, can you tell us how you felt during the procedure?
Yeah, I had mine done last week,
And your skin looks beautiful, by the way. Yeah.
I couldn't feel anything during it. It was honestly amazing.
And how much pain would you, have you done Fraxel without a block?
I had like a very minimal Fraxel beforehand.
But
and
you know it
was-
hurts, you right? So that's the
yeah.
painful. But for
Yeah.
like 20 or 30 minutes, where how much pain was from the shots?
Like, minimal. Like,
Yeah.
it was all.
It's not pleasant, but it's a shot.
But yeah.
How'd you feel for
I
the
didn't feel
shots?
nothing.
The shots weren't bad. I
You
feel
can't move your mouth
super
now?
numb.
Yeah.
We know it's working.
Yeah, we're going to go this technique again. We're going to save this for our staff to review. So I enter at the lateral orbit, subcutaneous, and I'm injecting as I'm advancing. And we go as far as the needle will go. This is a 30 gauge, 1-inch needle. My second poke will be in the partially anesthetized area here to get the rest of the supraorbital and the supratrochlear nerve. Again, just volume makes this, you don't have to be real precise. Okay, so that's our one nerve block. Second one I'm going to do is the auricular nerve. So I'm getting a little bit of it from the cervical block, and I'm getting the auricular temporal nerve by injecting up along the ear. And now I'll do my cervical block. Again, I'll mark the sternocleidomastoid muscle, the edge of it. It's right here. So I'm just going to put boluses in the upper third. If I was doing her neck, I would also inject the lower half of the sternocleidomastoid muscle. About 1 cc in each point, and that's all I need to do. If I was doing her neck, I would just go down 2 more shots. So it's an extremely safe cervical block.
Did you
Now
do
I'm gonna
zygomatic? Yeah.
I'm going to do zygomatic next. So again, the intersection for doing the zygomatic is you feel the orbital rim. It's right here. And I feel the zygomatic process here. And the nerves exit. They're right behind here is where I'm putting my shot. I'm not really going deep. I'm going subcutaneous, but the nerves exit here and here and here. But we only have to do one point to save a lot of distress. So I'm just going to go right in that little intersection. Go about a half an inch, or sorry, about half a centimeter, 1 centimeter deep. A nice 2 cc bolus. And I'm going to finish it off. I need one more carpule. I'll pour it on your side since I'm right-handed. Oh, did I already do both sides of your mouth? No, I just did the one side.
You did the both uppers.
Did both
Yeah,
uppers.
you did both.
I think you did both lowers, actually.
Okay, I'll do that.
Just the bottom there.
Finish off. Actually, I did do this side.
Yeah. Let's get a little extra.
There's one carton we do these too. Okay, so this takes, I'll wait about 5 or 10 minutes and she will be blocked, but this is a facial nerve block. Now, what is the limitations? Well, there's a buccal nerve, B-U-C-C-L nerve right here, and there's a small patch of skin somewhere that will not be numb. We don't have to worry about that. It's going to be area she can tolerate it. And it's really too hard to do a buccal nerve block without really distorting the face. We're not going to worry about that. Pretty much everything should be numb. She can touch us afterwards. If I have a missed spot, it's usually going to be right here because I'm right-handed. For some reason, if I miss a block, it's the right infraorbital nerve block on top. But that usually works. And then she'll be totally numb for about an hour, hour and a half. So that's nice. Get through the procedure really easy. Actually, the procedure goes a lot faster than not stopping and taking a break. She can be more precise, not worry about the patient's discomfort. And then you just kind of get through this nice and easy. What's the risks to doing a nerve block? Well, there's a few. So first off, there's some procedures where we need feedback from the patient on whether or not we're burning them. Okay, classic example would be laser hair removal. In laser hair removal, our target is the color of the hair. And if you get too much energy, you can burn the patient. Not enough energy, it really won't work. So we want that feedback. Laser vein treatment, same thing. We want the feedback from the patient. For the Fraxel, the only risk for burning is if Taylor doesn't do the procedure properly. So I'm confident she can do this properly. She's done it over and over again. We don't need any feedback from the patient. All we gotta do is not put too much heat in one area at one time. All therapy, perfect for that. Again, it's getting very precise burns. And even doing fillers, if we do the threading, we call biostimulation, that's painful. I don't need the patient's feedback. I'd rather just like keep the mouth shut and not slow me down. So this makes the procedure much neater. I really appreciate Morgan letting us use it as your model now.
Yes.
Model with a numb face.
And how long will the numbing last?
About 2 hours. Yeah, about 2 hours, and it's lidocaine with epinephrine. So unless someone's given an allergy to lidocaine, we have to use some other agent. Gives a nice, safe block.
That takes away the hour of numbing topically.
It saves an hour, and even the procedure goes faster because when we're not taking a pain break, which is really, pain in the butt to take a pain break because it hurts that much. And she'll just have little spots. She feels something, mostly right here, the little patch. It'll be essentially painless, and then just let us do our job. So thank you very much.
Thanks.
So now,
Thank you, Morgan.
Now hit the